Hello, welcome to the Faith Community Research Network Town Hall series on COVID-19 Medical Mythbusters. Faith Community Research Network is a collaboration between Wayne State University, Karmanos Cancer Institute, and the Faith-Based Genetic Research Institute. It's important to partner with churches in the Detroit area to get rid of the misinformation that has been circling around, especially about COVID-19. So we brought together a panel of experts to deal with all of the questions that many of us have heard in the media or on social media today. My name is Rochelle Chapman. I am the co-director of the Faith Community Research Network, along with Dr. Haley Thompson and attorney Bertram Marks, as well as the Community Engagement Coordinator at CURES, Wayne State University. So I'm all for the Center for Urban Responses to Environmental Stressors, and I'm a senior pastor in Detroit, Michigan. It is important that we bring this panel to you so that you can have your questions and any medical mistrust issues. We want to make sure that we address those things as well today. I'm not by myself. I have a wonderful co-host today, Vancille Brown-Miller, who will introduce herself.
Hi, I'm Vancille Brown-Miller, and I'm with the Office of Cancer Health Equity and Community Engagement. I oversee our Cancer Action Councils. These are groups, and now we're at 11, of community people who come together around now specific subjects around cancer and other health-related issues. They have a focus on research to understand research and community engagement within the realm of research and the community. I am also the health ministry chair of my church, and have been working in the community for a while.
Thank you, Vancille. We're so happy to have you here today. And so we're going to have our panelists introduce themselves and tell us a little bit about their work. We're going to start off on the end with Dr. Seth Norman. We're going to come back this way. So Dr. Seth, if you would introduce yourself and tell us more about your specific research and background.
Yeah, I'm Seth Norholm, and I'm an associate professor in psychiatry here at Wayne State, and I'm a neuroscientist and clinical psychologist by training. I spent the last 20 years studying human stress and anxiety and fear-related disorders, all the way from how you can help individuals with fear and anxiety to how you can make a difference in the community with stressors that affect a large number of people at the same time. So thrilled to be here today. Thank you.
Next, we have Brittany Dow, who will introduce herself and give us her background information.
Thank you, Rochelle. My name is, like you said, Brittany Dow, and I am the director of the Office of Cancer Health Equity and Community Engagement. So I work very closely with Vancille to manage the day-to-day operations of the office. We monitor the cancer burden throughout Karmanos' 46 county catchment area. So I did work on a project related to COVID-19, which is why I'm here today.
Thank you. And then next we have Dr. Paul Kilgore.
Thank you very much, Rochelle and Vancille. It's great to be here with these fantastic panelists. And I'm a physician by training, internal medicine. I have a public health background as well. But I've been working in the Detroit community for the past 11 years. I'm working closely with community-based organizations, but also doing research on the campus of Wayne State University to better understand the impact of COVID-19 and also how we can prevent the disease through vaccination. And we've also been working hard to communicate the value of the vaccines and how they work. So I'm really looking forward today to our discussion.
So let's get started. It's going to be like a rapid fire on medical mythbusters. And of course, any time you want to just input and give us expertise, we're going to talk about that. So let's kind of start at one of the very common myths. Some people say they didn't want to get vaccinated because there's a microchip being inserted while they're getting the vaccination. Dr. Kilgore, any of our panelists, you want to address that?
Sure, absolutely. So for everyone on the community, one thing I can tell you 100% for sure is that there is no microchip in the vaccines. And one of the reasons I say that is, first of all, physically, is it impossible to put a microchip into a vaccine vial and then draw it out with a syringe and then have a microchip go into the needle and into the syringe so that it would actually go into a human. We just don't do that. And secondly, there's no need for it. Thirdly, the manufacturers and the government, particularly FDA, would never allow it, number one. And number two, they wouldn't be putting it in because there's no need for it. And if they even tried to do it, it would be expensive. And And because there's no reason to ever do that, they would never be doing that. So one thing I can guarantee the audience and everyone out there 100% is that there is no microchip in the vaccine.
Well, that's good to know. Of course, there's no camera in the vaccine, but people have some strong feelings about the vaccine itself, and they sort of feel like it's dangerous. Like the ingredients in the vaccine can hurt you, and hurt you now, and hurt you long term. And so, what are your thoughts about that?
So it's a great question. And we also, as researchers, as people working to introduce vaccines, we are very concerned about vaccine safety. In fact, I tell all my students and colleagues that's number one. That's the number one issue we're concerned with when we do a study about a new vaccine. So a couple of things people need to know about these vaccines. One is that they've actually been in development for a very long time. We know when the mRNA vaccines came out that it sounded like a very new thing. But in fact, mRNA vaccines had been in research and development for a good 10 years prior to COVID-19 coming on the scene. The other thing I can tell you is that when we've actually been developing the vaccines, we not only are monitoring the adverse events extremely carefully, we have all the individuals who are in our trials report the vaccine adverse events to us directly. So we do that very carefully through an app on the phone, through our phone system, and we also record those, and we talk with everyone who gets the vaccine and has any experience after the vaccine. The other thing I can tell you is from our experience giving now these vaccines to millions of people, when we look at the adverse event profile for all the vaccines, including the Janssen vaccine or Johnson & Johnson vaccine, the Moderna, the Pfizer vaccines, the common adverse events that we see are ones that we've seen typically with the other vaccines for many years. So that includes low-grade fever, some soreness or pain at the injection site, tenderness, maybe some swelling or redness, and general malaise, just not feeling great for a day or two, and then fatigue. These are the major adverse events or side effects that we see with the vaccine. They've been observed before. They are things that we can actually deal with and treat even if people need treatment. That's very, very manageable after you get the vaccine. In fact, for the folks that I know who cannot get the vaccine, the major contraindication for not getting the vaccine that we've seen so far is having an allergy to a vaccine dose. And people who have had an allergy to a prior vaccine dose, those are people that we typically talk to and give advice and guidance on what to do next.
And I would just add to that, Dr. Kilgore did a very nice job of explaining the medical issues behind the vaccine and some of the things that have been concerned. The one thing from a psychological standpoint that we have to consider is the degree of misinformation that's present. And that's present in the mass media, it's present in social media. And so a lot of what Dr. Kilgore was talking about is based on scientific evidence. So we've known that these vaccines have been in development for a number of years. The mRNA technology has been in development for a number of years. But what we can't really account for very well is the conspiracy theories and the misinformation that develops. And we're in an era now where you don't necessarily have to dig deep to find the scientific evidence. If something is written in an article or posted on Facebook or tweeted out, it's accepted as fact by a large number of people. And so it doesn't necessarily have to have any evidence behind it, but if it can have millions of clicks and millions of followers, all of a sudden these rumors become fact and become truth in the general public. So this idea of microchipping, that has its roots in science fiction, and this idea that big government can watch you and they can do it with these implantable devices. And that's just not the case. And this idea that there are metals in the vaccines or there's mercury in the vaccines. There are roots to some of that in the early literature, which is, yes, there were forms of mercury in vaccines at one time, but they weren't harmful types of mercury. And even in the abundance of caution, that was taken out of vaccines in the early 2000s. So some of these conspiracy theories do have a small seed in truth and reality that gets overblown through all these means that we have available to us, that you're scrolling through your phone, you see that, oh wait, this vaccine is linked to autism. And these links are either completely disproven or very weak. So what we're battling is the scientific voices versus the popular voices across a number of media platforms.
That's an excellent point, because I have teenage niece and nephew, and TikTok is the deciding factor, not the CDC, not any type of, peer-reviewed journal articles or research, but it's TikTok. Brittany, you were going to say something, and Dr. Kilgore.
Yeah, to your point, Rochelle, I wanted to ask Dr. Kilgore, what are like the most reliable places where folks can get information about COVID-19 vaccines? I know in my work with community stakeholders, there was lots of vaccine hesitancy. My group met last year, so we started meeting in January of 2021, so we know the vaccines weren't widely available to everyone yet, but still that hesitancy lingered throughout. And I believe, we're talking about it still, so it's still going on. So.
Yeah, absolutely. It's a great question. There actually are about 4 or 5 key resources that I use personally that I would recommend. One of them, of course, is the US CDC website. And all you need to do in Google or other search engines, type in COVID-19, vaccine, and you can also add CDC to that, and you'll find their information very quickly. Another one is the US NIH website. They also have COVID-19 vaccine information. It's a little bit more oriented toward the research end of things, but still very reliable, very credible, and accurate information. There is another website at the Michigan Department of Health and Human Services, which I'd like to recommend. They have a lot of information.
If you look at the past 18, 24 months and the progression of cases in the U.S., initially in 2020, what we saw was, an explosion of cases. And in large part, that was because A, we didn't have the vaccines, and B, we had an administration that really wasn't handling it well. And so what I mean by that is there was not only misinformation, but there was wrong information in that there was an attempt really to take the authority away from CDC or World Health Organization, who are trying to battle this worldwide pandemic. And when you have government officials second guessing what the CDC is saying, all of a sudden there's a mistrust. And that mistrust issue just grew and grew and grew. So you had mistrust with the medical establishment to begin with. And if you want to talk about populations like in Detroit and like in Atlanta, there's already an existing mistrust, especially in underserved populations. So that mistrust exploded. And because there was this distrust in government health agencies, there was a hesitancy to get the vaccine initially. And so you had this underlying mistrust. So you couldn't go to nationally available resources. So my advice to a lot of people was, don't go to the CDC, especially in 2020 and early 2021. Go to your local health departments, go to your EMTs, go to your providers, and let them tell you what they're seeing. Let them tell you what you should be doing, because there was just a gap in what we were telling the public from a government and society standpoint versus what was going on regionally.
What are some ways that we can combat? And I know you said about going to, your local health department, talking to the EMTs and things like that. But what are some of the ways that you help combat with that? And even then I'll come back to the coping, question for that. But just thinking about even in terms of community engagement, what's the message that we're spreading about this? So, Dr. Norman.
Yeah, we spent a good part of 2020 really trying to understand COVID-19. And the way that we did it was, and this is with an organization here that's our Neuroscience Center for Anxiety, Stress, and Trauma. And then we have a sister program called the Detroit Trauma Project. And really it's to understand trauma at the community level. So we were already doing a lot of these efforts. And this is in collaboration with Tanya Yovanovitch and several others in psychiatry, where we wanted to understand trauma within the community. And so here was this opportunity to learn more about how communities respond to stressors, especially one that is so widespread as a pandemic. And so what we did was we actually started a study where we were contacting people who had taken part in our research studies before, and they had a mobile app on their phone, and we were asking them questions about, what was their isolation like? Who do they have contacts with? Were they still in touch with family members? Because one of the things that we know in psychiatry is that in the face of stress, if you have a support system, if you have resources, that can be a buffer against the long-term effects of stress. So we wanted to know, is a virtual support system, because we were doing Zoom and we were doing phone calls and it was all, web-based and mobile app-based, is that the same as having a group around you socially in person? And we found that in a lot of ways it is. And so if you did have access to friends and family and resources, that it was a buffering effect. But we also found out was that there was a difference based on where you were in the community. So we were, obviously we're in Detroit and neighboring communities and then out to Macomb and other counties. And what we found was there were actually differences, cultural differences. So if you ask people who their support system was or who they were concerned about, in the Black and African American communities, they were more concerned about their family and other people. So there was a much more communal sense. Whereas if you looked at the more, Caucasian and white communities, it was much more individualistic. So we found that there was a difference in how people were handling this pandemic. So one of the things that we did was, what were some of the coping strategies that were available to you? And what we found was that if you had access to medical care, to your physician, if you had access to your pastoral staff and your faith leaders, that was very effective in buffering your stress about getting infected or other people getting infected and having serious health consequences. So we know that from a community standpoint, I'm bringing home this point again, what's going on locally was much more important. So it had less to do with what the national response to the disease was or how the vaccine rollout was going, to what you had available to you. And that brings me to my last point, which is in terms of how you fight mistrust and how you get real evidence-based education to the community, is you need to have a community-based effort. You need to be engaging with community organizations like you all do, but also to have mobile health units available. So one of our biggest initiatives in psychiatry now is less focused on getting people to come to us for their clinical needs or for research studies, but to bring them out to them with mobile vans. And Wayne Health does this quite a bit with Phil Levy and others that are here at iBio, is to bring the resources and the education to the community.
And that's actually a perfect segue into the work that I did. So I was a project coordinator for a project that looked at supporting Detroit communities to become leaders and partners in COVID-19 research. And the really big thing that we did for that project was bring together a COVID-19 Action Council. So this was a group of community stakeholders who either identified as a COVID-19 survivor, they were caregivers for someone with COVID-19, essential workers, so thinking about our healthcare and health facility staff, teachers, and then advocates. And really what that group did when they came together is they learned about research, but they also were able to share their concerns about COVID-19 and turn those concerns that they had within their communities into research action. So we took them through a process of developing their own research priorities, as well as research questions related to those priorities. So like I was talking with Dr. Kilgore about, a lot of, one of the main priorities was vaccine hesitancy around the COVID-19 vaccine. And a lot of people weren't getting the type of messaging that they thought they would have received about vaccines. Dr. Norm's point, just all the misinformation on social media, being able to, type into Google anything about a vaccine and just getting a bunch of information that wasn't necessarily truthful. So the group really focused on just messaging, health communications. It was a really great group. I'm really thankful for that time to be able to do that type of community engaged research. And I know the community, at least when we talked, like they were also really thankful just for that community space and to have those resources given to them in that matter.
Yeah. What if someone says the pandemic is over and things can return to normal? What would you say to somebody that said that?
Yeah, I would definitely call that a myth. So we know that the virus is still out there.
Yeah.
What we do know is that there are still people who are vulnerable. There are still populations that are immunocompromised that we need to be looking out for. I think we need to be thinking about it the same way we think about flu. So I think we need to be more receptive to the idea that we may have to have annual COVID shots, just like we have annual flu shots. So part of our healthcare should be these vaccines as long as they're needed. Keeping in mind that even if you personally have a low chance of becoming infected or of having severe symptoms that require hospitalization. So one thing we should point out as part of this panel is that while what we do know is that the vaccinations severely reduce the chance you're going to have a severe illness or a hospitalization. Doesn't mean you're not going to get the disease or test positive on a at-home test. But this idea that we should be vigilant about it because it's still in the environment, that we would need to be thinking about our communities and thinking about those that are undergoing cancer treatments and those that are elderly and those that have pre-existing conditions. So even though you may feel like you're pretty well protected and you don't need the mask anymore, think about who's around you at the grocery store, at work, and be a little considerate about that.
Pre-existing conditions, say what those are.
Great question, Monsieur. Pre-existing conditions are other illnesses that we have, often chronic. So, good example is diabetes, especially adult diabetes, but also type 1 or childhood diabetes. High blood pressure is another. Cardiovascular disease, so it could have been that you had a heart attack or you have some congestive heart failure. Also, we talk about other immunocompromising conditions. Some people have autoimmune conditions. That can often be a way to be susceptible to infections. Another is certainly our lung diseases. So underlying lung disease, cystic fibrosis, COPD, or chronic obstructive pulmonary disease. These are other examples.
Yeah.
And I could go on, but the list is long. Many people, as we get older, we acquire these illnesses, and it's good that we manage them. That's important for sure.
Right.
The better we manage them, the better we are going to protect ourselves also against COVID-19, severe effects of COVID-19.
Yeah.
Dr. Kilgore, what would you say to someone who has a child? Should I vaccinate my child?
No, that's a great question, really. And one of the things I can reassure people right now is from the clinical trials and from the introduction of the vaccines that we have now for children, the vaccines are both safe and effective. One of the things I can also tell you is that now the vaccine's been used in several thousand Americans, and the data that we've collected show us that the adverse events and the side effects of the vaccine are very similar to other childhood vaccines that we're already using. And I think that's very reassuring to me. The other thing that I think parents should also know is that when we vaccinate a child and they go to school, it does help protect that child, but also it helps reduce transmission within the school, and it avoids us spreading the virus in the community.
I think the biggest thing I would say, like for the community voice, is just the importance for community to be involved in research. And it doesn't necessarily have to be that you're taking a survey or you're participating in a focus group or you're in a clinical trial. There's many levels to research, and there's many things you can do to become involved with research, like the work of the COVID-19 Action Council. It was a way for them to create community and make community, and talk about their concerns with COVID-19, to create priorities and research questions that are aligned with others at Wayne State University and abroad. So I would say the biggest thing that I would think about from a community perspective is just the importance of research and getting involved with it.
So many things we can continue to talk about on this COVID-19 panel, but thank you, Dr. Kilgore. Thank you, Brittany Dow, and thank you, Dr. Norum, for your time. We appreciate you. Thank you all for tuning in to the Faith Community Research Network, Medical Mythbusters on COVID-19. We want your voice to be at the table. We'll be sending out a network survey. The information is on the screen so that you can give us your feedback as well. I want you to stay in contact with us. Our website is www.faithcommunityresearch.org. Telephone number is 313-577-5045. On behalf of myself and on our panelists' behalf, as well as Dr. Haley Thompson, Attorney Bertram Marks, who are the co-directors of the Faith Community Research Network, we thank you for your time. God bless you. What a phenomenal segment. We have now reached a spotlight section of our show today. And we have one of our incredible Faith Community Research Network pastors. As we talked about earlier, that we are a partnership of 11 network churches. Dr. Connor is going to introduce our special pastor today, and we're going to ask her a couple questions.
We have a great pastor who is in the particular part of our vineyard, Dr. Jean Overman, who is just such a delight, and she does such great work in the Inkster area, partnering with so many different churches, but also being a leader and a liaison in our community. We're so glad to have you.
Thank you so much for the invite and to be a part of our team. We're really doing some great work. I'm very excited about what we're doing in Outland County. It's not just the city of Inkster, but all of our boundary communities, and we're making a lot of things happen. So thank you for the invite. I'm from Christ Temple City of Refuge in Inkster, where Mac A. Hall Jr. is our senior pastor, and everything outside of the church walls is for me to cover. So I'm here as the director of outreach, as well as the pastor of outreach for Christ Temple.
Wow.
That's beautiful. As we talk about, combining the spiritual and the practical, faith and science and medicine, What do you think is the importance of Faith Community Research Network?
Oh my goodness, if I really just shared with the few minutes that I have, the real reason that I became a part of it was my husband passed in 2014 of cancer, and his mom and his dad passed of cancer in 2014, and they all had liver cancer. So I really wanted to know the genetics behind it. So I was invited to be a part of the research team. And once I got involved, I couldn't let it go because of how we were able to engage the community. I'm on the board of directors for one of the clinics out Wayne County. And to know that our people in particular, we missed the mark. And as the earlier segment said, we're dying 15 years too early. So we're missing out on our children's proms and high school graduations simply by the way we live. So to find out the research, to be a part of that, and to be able to share that out Wayne County is something that I'm very thankful to God that we really understand. Luke was a physician for a reason. It's because God wants us to incorporate every gift that he's given man. And I know medicine, research, and science is a part of that gift.
Pastor Overman, how are you liking the collaboration with other Faith Community Research Network
Oh my
pastors
goodness.
and the synergy? If you guys could be a part of our meetings and the synergy that's there, I want you to talk a little bit about that, but then also how would you encourage other pastors to participate in the Faith Community Research Network and a part of this whole champion this, being able to get this education out to the faith-based community?
Okay. So as I think about this, and I'm so excited about you all and what you're bringing, just the fact that we're on media, right? The fact that we can share this on a national network. Just speak that thing, right?
That's
And
right.
to know that you, Dr. Chapman, and you, young man, who I can't believe is an adult here, is able.
It's a grown man with a beard. No,
I
I'm just
know,
joking.
and that baby face. But to know that we are sitting together, changing generational outcomes, right? So if we
Wow.
can get our churches on board, and they are coming, right, from all over, to be a part of this great work, the outcomes that we are measurable will be phenomenal for us as people of color. Because in the earlier conversation, the fact that legislation must change.
Yes.
We don't need another store that don't bring healthy food. These kind of things and this social justice and the social determinants of health that this group works on, and that fact that we have God first,
Yes.
right? And we know we're favored, and that we can just see, really, seriously, the young people, the empowerment that you're bringing. I'm 67, so I've seen more sons that way than I'll see this way. But I'm very confident of you two and the people that you're influencing, and the fact that you are influencers, and that we will change those outcomes for us. We inherited dimples. We don't have to inherit high blood pressure, heart disease. So when you come and you're able to explain that from the pulpit, the place that we have our influence, we change outcomes. So thank you for
Wow.
asking that. We're going to do this.
Thank you so very much, Pastor Overman, for being our Spotlight Pastor. You'll hear
this is
more
cool.
information on the screen about Pastor Overman and her church and the Faith Community Research Network. Thank you.